Welcome everyone today. We're talking about what to bring to the emergency room, but I also included in there what to expect about wait times and stress reduction, things that you might bump into when you're in the emergency room, and the difference between going to the emergency room and maybe going to an urgent care center, a walk-in clinic, or even your doctor. Older adults age 65 and older contribute to almost a quarter of all visits to the emergency room, despite only consisting just 14% of the general population. This trend is projected to persist with the anticipated 30% increase in emergency room utilizations as patients age. However, what we found is that even after receiving care in the emergency room, the needs of the older adult also remains unaddressed. Nearly 80% of older adults discharged from the emergency room carry at least one unattended health concern. Further, within 6 months of discharge from their initial emergency room visit, almost 44% of older adults revisit the emergency room at least once, and around 7.5% return within 3 months or more. While this reattendance may be the result of disease progression or overall frailty, given the large proportion of patients with unattended health concerns, it's also likely that at least some of these patients return due to their needs not being met. So when we talk about being prepared to go to the emergency room, what to pack, what to bring, it really, when you look at these statistics and how their people are returning, it probably isn't a bad idea to have something packed and ready to go, or at least of things that you can throw in your bag and get ready to go when you go to the emergency room. Just a little disclaimer here, information provided in this program does not replace any information you receive from your medical practitioner, but only a guide to help you make sound decisions. In the event of a medical emergency, we suggest you follow your physician's advice or call 911. So anything that we talk about in here are ideas and suggestions. You have to make the final decision whether you go to the emergency room. You can be seen at a treatment center or your doctor's walk-in clinic for your health concerns. So our objectives for today is to provide information that is going to help you go through that emergency experience and make that flow a little bit better for you. Some strategies for handling stress in the emergency room and following up with discharge instructions, which is extremely important. As I was doing my research, and I'm trying to get this little box out of the way so you can see it. And I will tell you that this I picked up from ARP, and it shows the waiting time in the emergency rooms. Now, it has Northwest Community Hospital, which we know is a hospital out in this area. The average time before you see a doctor or nurse is 20 minutes. Average time before outpatients are sent home is 2 hours and 50 minutes, and they see about 70,000 people a year. If you look at the other ones here, they say it's an hour, 54 minutes. You can take a look at this. If you want to take a picture of it, fine. What I'm going to tell you is I'm not sure this is accurate. I had my granddaughter, I should say, 13 years old, passed out after gym at school. And because she hit her head, my daughter had to take her to the emergency room. So they went to the emergency room in their community, which is a very well-known qualified hospital, and they waited 8 hours, 8 hours in the emergency room to be seen for a head injury. So we know that You know, these numbers are probably played with a little bit, I might say. I'm not sure what they got these numbers from. I just found it interesting because this popped up when I was working on it, and I knew my granddaughter was sitting in the emergency room with a nice little knot on her head and a lip that needed a stitch. So 8 hours. The fastest to admit inpatients, they say, is 4 hours and 9 minutes, and 4.36% give up and leave. And that's a problem, because if you're sick enough to go to the emergency room, you shouldn't be leaving there. And when we talk about people not having their health care attended to, that can be a problem. Quickest with pain meds for broken bones was 16 minutes. I sat in the emergency room one time with my sister, who fell and dislocated her shoulder. And while it wasn't a broken shoulder, it was a dislocated shoulder. Very, very uncomfortable. And it was almost an hour and a half before she got anything for pain. So again, I'm not sure where they're getting this data from. Oh, the Illinois Department of Public Health. So, and these are a little bit older. So, you know, I don't think things have improved in that. So my big thing, I guess, from this is prepare to wait. And if you feel that it's too difficult for you to wait, that can be a problem. So urgent care, we're going to talk about urgent cares today, but urgent cares differentiate between emergency rooms because it really kind of depends on what type of care you need. So the national average for a urgent care is about 2.5 hours, and that is pretty accurate. You get 2 to 3 hours wait time in a urgent care center. You know, we call them urgent care centers. They're walk-in clinics. Urgent care centers. We'll differentiate between that and the emergency room in a minute. This in no way is a complete list. And again, you're going to follow your gut feeling. You're going to follow the instructions of your doctor. But when we talk about why people in general go to the emergency room and why they choose not to and go someplace else, this would be part of the reason. Shortness of breath, chest pain, heavy bleeding that doesn't stop, a head injury, a severe abdominal pain, loss of consciousness, seizures, coughing or vomiting blood, diarrhea, fever, and signs of a stroke. Now, going back to my granddaughter, and I don't mean to be talking about my family, but this just happened. And, you know, you may think to yourself, okay, she had a knot on her head. It wasn't very big, but it needed to be followed through because she passed out at school and hit her head. They could stitch up her lip at a treatment center, but what could they not do at a treatment center that they can do in an emergency room? And that would be a CAT scan. They're going to want to do a CAT scan or an MRI of the head to make sure there's no bleeding, and they can't do that at a treatment center. So that is why when you have a head injury, you go to the emergency room. If you have weakness or numbness on one side of the body, slurred speech, severe dizziness, vision problems such as double vision or loss of vision, if you have broken bones or dislocated joints, loss of consciousness, burns with blisters, severe abdominal pain, like I said, larger cuts that require many stitches, a fever of 103 with a rash, vaginal bleeding during pregnancy, poisoning, and any mental health crisis. And again, if we look at that mental health crisis, they have 24-hour coverage of mental health assistance in the emergency room. And that's something they don't have at urgent care centers. So if anybody's experiencing a mental health crisis, they really need to go to an emergency room. And again, you're going to use your common sense for this and know that and make that decision on where to go, or listen to your doctor, or just call 911. One of the things, and I thought I would just add this in here because it's always a good reminder, is one of the things that you want to go to the emergency room for. And why? Because they're going to want to do an MRI or a CAT scan on your brain, is a stroke. And there's an acronym for a stroke, and that's called Be Fast. And Be Fast stands for difficulties in your balance. So if you see this in yourself or someone else, you need to call 911 and get to the emergency room immediately. So balance difficulties, eyesight changes, maybe your vision is gone, maybe it's blurred. If you have difficulty walking, going back to the balancing, if you have weakness on either side of your face, you can look in the mirror and smile. And if your smile doesn't look even, if you stick your tongue out, and when sticking your tongue out, it goes to one side or the other, that can be a sign of a stroke. Arm weakness on one side or the other, speech difficulties, slurring speech, not being able to talk at all. And the last thing is time. Time is of the essence, because if they can do that CAT scan and they can see whether it's a bleed or a clot, if it's a clot, within so much time between the onset of symptoms and being in the emergency room, if they can get it at that perfect time, they can give you a clot buster. And for many, many people, it will get rid of the symptoms of the stroke because it dissolves the clot. So time really is of the essence when you have a stroke. The other thing is severe sudden headache with no known cause. And actually, I was just watching the Jamie Foxx thing last night because I wanted to see. I pretty much assumed that he had had a brain bleed and a stroke, and he did. And it has a lot of foul language in it, but that's Jamie Foxx. But it really was, he was quite grateful for the care that he got, not only in Alabama, but in Illinois at the Shirley Ryan Ability Lab. But his first symptom was a severe headache. He had a severe headache and he was unconscious within minutes. So being, knowing that you may have a stroke, even if you're wrong, it's okay. You have to work fast or be fast. All right, so what do you want to bring to the emergency room? What do you want to pack on that bag? And again, you may have a bag that you can throw this stuff in and have some of the stuff ready. Obviously, you're not going to have everything ready, but if you have this list, and you can certainly take a picture of this, you will see that we have your insurance. So if you're on Medicare, we need your Medicare card or your other primary insurance, whatever you have, and then your supplemental. You don't need to bring your pharmaceutical drug card, but your supplemental insurance. What I will tell you is they may have some of this information already. However, you never know where you're going to end up in the emergency room. If you're in the emergency room in your primary hospital and they have my chart, which every hospital has now, a lot of this information is already on the my chart, but they need to update it. So you really want to throw this stuff in a bag. So you can have some of this stuff ready and then throw this stuff in the bag. Insurance, primary, supplemental, like I said, government issue ID, emergency contact information. Who is your next of kin? Who do you want information relayed to? Your POA and your advanced directives. That could be your post or your POA, your advanced directives. It could be, your POA might be at the end of your will. Sometimes they do that. So you may have to bring your whole will in if your if you can't separate your POA and advanced directives out of that. What I will tell you is bring that or have a copy of it and keep it in that bag. If you bring it to the hospital, make sure that they take a copy of it and give it back to you. You need that original back. Reading glasses. You're going to be doing some reading and signing some papers, so you'll need some reading glasses. They don't supply those. Hearing aids, you need to hear what the nurse, the doctor, the people in the insurance part of the hospital have to say. You want to bring a note and a notepad and a pen with, because you may be so anxious that by the time you get home, you may not remember everything they say. And so you may want to jot things down. You may not be the patient doing this, but you may want to give that person that is with you in the emergency room to write things down that you feel are important. A list of your current medications. Please don't bring all your expired medications. All you're going to bring is the medications that you are currently taking, as well as a list of allergies. You want to let them know whatever food allergies they have, and whatever if you have any allergies to any medications. For example, I'm allergic to fish. So I have to be careful with betadine because there are elements of fish products in betadine. So sometimes they use, colored dye. They inject that for tests, and that might have a basis of a fish allergy. So you need to let them know both that food and medication allergy. What's the name of your primary doctor? And a phone number. And again, this might pop up if you're at the hospital that you normally go to, but if you're on vacation and they need to talk to your primary doctor, they're going to need a phone number. And so in the essence of time, if you have your primary doctor there and a phone number, then they can call. I knew someone who fractured their femur in Mexico, and they needed to call her orthopedic surgeon because she had already had a hip replacement, and they were sending her to, they weren't fixing it in Mexico, they were sending her to Miami to get her hip refixed, but they wanted the medical records, and they wanted to talk to that orthopedic surgeon. So again, if you've had any limb replacement or, a knee or a hip, you probably want the name of the doctor that did that. You're going to have to bring a credit card because some hospitals want you to pay that copay immediately. I think I see that getting more and more, especially as, the government changes and we look at certain things, you may have to pay for that in advance. So make sure you have a credit card on hand. If you swallowed any poisons, and hopefully you're not doing it on purpose, but if you have swallowed poisons accidentally or on purpose and changed your mind, you need to bring those swallowed poisons with, because the antidote, and they may have to get a hold of the Poison Control Center and let them know what is in there and what the antidote would be for that. And then any missing limbs. So if I was mowing the lawn and I was getting a clump of grass out of my lawnmower and cut off the tip of my finger, I want to bring that finger in a cup and bring it to the emergency room. So any missing limbs. All right. So a little bit different is when to go to urgent care, which we call urgent care, walk-in clinics. There's different names for them. They may be helpful if an injury or illness isn't as severe, but a same-day appointment is needed. So sometimes you have to call ahead. Many urgent cares are just walk-ins and are available during times when your primary care clinic may be closed. This includes early mornings, evenings, weekends, and holidays. Some symptoms that may prompt a same-day visit to an urgent care would include wheezing or mild shortness of breath, sprains or strains, minor burns without blisters, small cuts that may need stitches, fever. So going back to my granddaughter, if she didn't hit her head and she just needed a stitch on her lip, she would have gone to an urgent care and had that done. Probably waited less time too, but flu symptoms, sore throat or ear pain, eye discharge, vomiting and diarrhea, painful urination, which could be indicative of a urinary tract infection, animal or an insect bite. Now, there's some speculation on this, whether you should go to an urgent care or the hospital, and I will tell you why. If you don't know that you're allergic to bees, I was at an urgent care once waiting with someone, and a lady came in and she had a bee sting. And they asked her if she was allergic to bee stings, and she said she had never been stung by a bee. And by the time she got back to the room, so they could give her a dose of epi, She was already wheezing and breaking out in a rash, and they called 911 and took her to the hospital, because at the hospital they have the higher level medications that they need for that type of thing. So I would say with a bee sting, you just never know. And if you're starting to feel your lips go numb and you're tingling, or you're a rash, having difficulty breathing, I would go to the emergency room. But again, you have to follow what you feel is important, because this is in no way, these are just recommendations. Minor allergic reactions, again, could be part of that. All right, so urgent care wait times are typically shorter than the ER, but that's no reason to go there if you don't belong there. Again, if you belong in an ER, you need to go to the emergency room. Copays at urgent care clinics are usually about the same or slightly higher than you have at your doctor's. They also have something called walk-in clinics. My doctor has this from 7:30 until 10 o'clock, Monday through Friday. They have a walk-in clinic. You're either seen by the PA, the nurse practitioner, or a doctor that was assigned that morning. You're not probably going to see your primary care practitioner, but you're going to get taken care of. And they're typically just walk-in. So I would call your primary care provider and see if they have a walk-in clinic, just so you know that they have it. That way, if you wake up one day and you're not feeling good, and it's not enough to go to the emergency room, but you know you're not going to be able to be seen by your doctor that day, then I would think about going to a walk-in clinic. These are, again, non-life-threatening, and just something to think about. And typically you don't need an appointment, you just need to walk in. One of the things that I think is really important, very, very important, especially if you're seeing a doctor outside of your network and you're not connected to MyChart, is having the list of your medications and their doses and how frequently you take them on some kind of a card or a paper in that bag that you pack. This I got off the internet. I just typed in medication documentation and a bunch of, and hit image. You want to hit image on this, on medication dosage and times, blank, type in blank. And this is how I got this. And you can just write your medications in there. That's another thing you want to throw in that bag, because that's going to be important, that they know what medication you're taking, what's the dose on it, when was the last time you took it, so frequency, and then the prescriber. If you can't get anything else on that, medication, dose, and frequency. Prescriber's good, but they want to know what medication. If you're having a stroke, they're going to want to know maybe what kind of, are you on a blood pressure medicine, what kind of blood pressure medicine it is, because there's a lot of different kinds, so they know how to treat you. If you bring in a bag of medications, it's going to take them hours to look at those meds and figure it out. So as you're preparing that bag that you're always going to have just kind of handy, you're going to put your medications on there. And I would do it in pencil. And if you ever, when you go to the doctor and they change your medication, you can erase, maybe they increased your dose or your frequency, or maybe they changed that medication altogether. All you have to do is erase it and put the new one in. But that's something you want to keep in your bag. All right, let's talk a little bit about stress in the emergency room, because I think a lot of people find being in the emergency room very, very stressful. I know I do. The last time I was in the emergency room, when my sister dislocated her shoulder in a fall, there was a mom in the emergency room who had 2 kids, and the 2 children, she was not watching them. And the kids were running around, and people were sitting there with IVs, and they're crashing into the IVs. It's very stressful to even sit and watch what's going on in an emergency room. But there's a lot of uncertainty that we experience going to the emergency room, not knowing what the cause of our pain or our issue is, or the extent of that medical problem. And that can lead to significant worry and fear. We also have pain and discomfort. Physical pain from injuries or illnesses can really be exacerbated with stress levels. The unfamiliar surroundings, the busy, loud, sterile environment of an ER can be overwhelming and disorienting. When you're sitting in that emergency room and you're watching people come in and there's people throwing up and there's, an ambulance coming, it can be very unnerving. The wait times, we know, if you've ever been to the emergency room, how long you had to wait, not only just to sit in the waiting room, but then you get to the back of the house where you're in a room and you're there forever. And then they order a test, maybe an ultrasound or a CAT scan, and it might be evening, so they may not have someone available to do it and they have to call that person in from home. Then it's more wait time. So it really can increase your anxiety and your frustration. And then medical procedures, fear of any invasive procedures or unknown treatments can cause significant stress. And we'll talk about communicating and asking questions. And this is one of the reasons it's so important. If you ask those questions and you know what's going on and you ask people to explain it to you and don't take no for an answer, it's going to help your stress level decline. It'll reduce that a little bit. So definitely ask when they're doing medical procedures, why are you doing this? What is this called? And there's that person with that notepad writing it down. We're going to do an ultrasound because they're going to rule out gallbladder. Okay. So at least you know why things are being done. The last thing is the seriousness of the situation, a life-threatening situation, the perception that it's life-threatening, and that can trigger a very strong stress response. We also see a lack of control. We're kind of surrendering ourselves to these healthcare professionals, and we're expecting them to act their best on our behalf. And 99.999% of the time, that's going to happen. But we are always anxious that they're going to miss something. So again, that's that lack of control. And then social isolation, being alone in a very stressful situation can really amplify anxiety. And that's why I always say, if you have a friend, a neighbor, a relative, a partner that can go to the emergency room with you, I think it's very helpful. I know that when I get stressed out, my husband is the one that calms me down. So I would, he's someone I would have with me in the emergency room. So think about bringing someone with you. So these are some of the reasons people experience stress in the emergency room. And these are ways that we can manage it. Why is stress important? Why is the management, I should say, of our stress important? It helps reduce our anxiety. And when we're less anxious, we cooperate more. We can hear what they're saying. It helps us physically because it reduces our blood pressure. So it's really a benefit to us to reduce our anxiety. And so thinking about stress management is important. It also helps us communicate with our healthcare professionals better. If you sound anxious and you sound snippy and you're snappy at the healthcare professionals, sometimes we don't know what their day or night has been like, and you may end up getting an attitude from them. But if you ask them in a calm, welcoming voice, your question, you probably will get that back. It also helps you make better decisions under pressure. We have to make some decisions in the ER. The doctor will recommend for you to do something, but we are partners in our healthcare now, and we can refuse to do things. So when we're under pressure, we may not make those right decisions. So managing our stress in the emergency room is extremely important. All right. So how do we do that? We open up our communication. Don't be afraid to ask questions to the healthcare providers. Ask them, I'm trying to understand. I don't work in healthcare. I don't know what this means. Can you use a word that I would know? Why are you doing this lab? What's that going to show? Okay, don't be afraid to ask those questions. Take time to do a little bit of relaxation and visualization, and it doesn't have to be dramatic. Just sitting there, taking some nice deep breaths, breathing it in, breathing it out, closing your eyes, and visualizing something positive. Maybe it's the weather outside, it's a beautiful spring day. Maybe it's your blood pressure coming down. Maybe it's your heart beating a little bit slower, but doing some visualization. You don't have to let anybody know what you're thinking, and you just breathe in and you breathe out. I talked about bringing someone with you for emotional support. I think that's a great idea. And bring something to distract you. I have to tell you, kind of funny, I went for a doctor's visit yesterday, and the last visit I went to see him was a 2.5 hour wait. And I didn't bring anything with me. And I was pretty irritated by the time I got into the doctor's office. And when he asked me how I was, I said, I was great 2 hours ago. And he kind of looked at me. But I thought, this is my own fault because I didn't prepare. So yesterday, I brought a book, I brought snacks, I brought some paperwork for Elderwerks that I need to work on. I got there, I sat down, they called me in. I thought, you know what? I'm going to prepare every time I go to this doctor, because I was ready if he wasn't. So bring something to distract you. Music, reading material, bring your iPad, your iPhone, your reader, bring a crossword puzzle, something that will keep you distracted. What I will tell you is, if you are going to be on your phone or you're going to be on listening to music, please, please, please use headphones. The whole emergency room does not need to hear the conversation about the last relative that died in your family, which I heard in a doctor's office once, or the rap music someone's listening to. So please, 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 if you're going to listen to music or have a phone conversation, do it on a headphone, because it's very distracting for other people around you. Now, here's some comfort items in the ER. And you can have some of this stuff ready, but you might be reading a book and you don't want it in there, but you can throw it in your bag as you're leaving. You want maybe a small pillow or a blanket. It tends to get a little cold in the emergency room. And so I would bring a little blanket, maybe a pillow to rest your head on, and then some reading material, like I said before, and whatever music device you have. ERs are not hotels, and so they do not have at their front desk chargers and other electronic devices for you. So bring the charger to your cell phone, because again, if you're at 50%, you're there 8 hours, you're going to run out of battery. Bring some small change or small bills for the pop or the snack machine, or throw some snacks in your bag. That'll be helpful. Put a protein bar in there, or something to munch on, maybe a small water bottle if you don't want to spend the exorbitant amount that vending machines charge nowadays. So I call these comfort items. They're not necessary, but they definitely are helpful. So again, have that bag somewhere in your house, and as you're ready to go, throw the rest of the stuff in it that you can't afford to keep in there all the time. I can't stress enough how communication is key. You want to share your symptoms and concerns very clearly and what you're experiencing now. They want to know what's happened in the last day or two. They don't want to hear in 1974 when you had your first bunion. And so you want to make sure that you're keeping it succinct and short and relevant to what is happening now. We all tend to do that. I do that myself. And so we have to think they're on a time clock, and so are we. We want to get seen. We want to get treated. We want to get out of there. Designate one person to communicate with the medical team. When you have something very traumatic and you're in the hospital and everybody starts to gather, it can get very confusing. So, if it's a life-threatening thing in the emergency room, assign one person to get the information and let them decipher that to the family. Let the staff know if you're feeling overwhelmed. I'm really anxious about what's going on. they have worked with people who are anxious all the time, and they're used to reassuring and making sure that you feel calm and informed. And again, if they're not doing that, they're not doing their job, you need to let someone know. And again, I'm telling you, ask questions. Now, these are things, what I did add to that is things that you should bring to the hospital if you end up getting admitted. So if you're planning a hospital stay, this is how you want to pack your bag. But if someone, if you're going from the ER into inpatient, maybe that person that's with you can bring the rest of the stuff for you. And many of the things on this item are almost exactly the same things that were in your ER bag, except for toiletries. Bring your toothbrush, your toothpaste, any skin cream, mouthwash. You can get it there, but they're not the best. And you know, the mouthwash might be small, and the soap might be Castile soap, and it may not be the soap you like if you have sensitive skin. So bring your own toiletries, your own hair dryer, comfortable clothing if you're not having to wear a hospital gown, some nice you know, sweatsuit or pajamas to wear, robe and non-slip slippers, although you'll get a pair of socks when you go to the emergency room, and they're usually color coded. So last time I was in the hospital, because I'm over 65, I had yellow socks on, and yellow at the hospital I was at means I'm a fall risk, and I'm just a fall risk because I'm over 65. Like I said, your phone charger, your iPad or something. You can bring your pillow. I mean, many people, I'm one of them, I can't sleep unless I have my own pillow. And but what I would suggest is that you don't put that pillow in a white pillowcase, because someone might come in and make your bed, take that pillowcase off that pillow, and you may lose that pillow. So use a colored pillowcase. Glasses, hearing aids case. And if you're on CPAP, take your CPAP machine. Hospitals don't have supplies of CPAP machines. And if you're having a health problem, making sure you're getting aerated and enough oxygen while you're sleeping is extremely important. What not to bring to the hospital? And I think this is all common sense stuff: cigarettes or tobacco products, vape pens, large sums of money. Make sure you don't have any money on you, actually. Maybe the person that's supporting you can have some money if you need it. You really want to take your wedding bands and stuff off, especially if you're going to be having surgery. Illicit drugs and alcohol, and then any perishable foods. You can have snacks in your room if it's permitted. Hospital policies are different in different hospitals, so you'll need to ask. But I don't think any hospital room works with perishable foods. So perishable foods are eaten and then taken out immediately by the family, but they can't stay in the room. So as we kind of wrap this up, and I'll be open for questions in a minute, some of our takeaways are today's wait times in healthcare is difficult, and it may get worse. We'll see. Many sick people are waiting too long to be treated, which can compromise their health. If your illness or injury is non-threatening, think about alternatives for the emergency room. And again, I'm not giving you advice on which to go to. I'm giving you some information that you can make sound decisions on. Having things that you should bring to the hospital in a bag where you just have to throw those last few things in will save time for you. Be kind to others around you when you're sitting in the emergency room. You have no idea how sick they are, how afraid they are, or how lonely they may be. And it's a bad time for you, and it's also a bad time for them. So be kind.